What we're doing now with in vitro fertilization is, rather than creating the embryo on day 5 and then transferring it back into the woman, we're actually taking that embryo and we're freezing it and waiting for the biopsy results to then be known, so that we can go ahead and then pick the right gender that the couple might want to have for their future child, and also with an embryo that has a normal number of chromosomes. We also, when we're dissociating the retrieval from the transfer, we're getting less ovarian hyperstimulation symptoms in that patient, because there's no chance of pregnancy can develop. And then we're also, because we're doing more pre-implantation genetic diagnosis, we're allowing ourselves to transfer just one chromosomally normal embryo of the requested gender, if that's something that's important for the couple. And in doing so, we can now approach a live delivery rate of anywhere from about 50 to 60%. So you can see here, this is the example I just gave you. If you're 35 because of decreased fertility, we have a lower number of blasts that are present. The aneuploidy rate is about 50-50 here. So about 50% of all the embryos are going to be chromosomally abnormal, and we have less embryos to cryopreserve. But when we get to 40, we start to really fall off, because of the fact that about 80 to 90% of the oocytes that we start with are going to be chromosomally abnormal. For patients that are over 40, and aren't doing well, and they don't develop euploid blasts, we have the following possible options. We could have them just stop conceiving and start to just conceive on their own, but that's not very acceptable to the company, to the couple. We could continue to have her try with her own oocytes, but the problem with that is it's a very low success rate, and we might miss her window of trying to conceive over those last couple of years. We could have her conceive with donor oocytes. For the woman that's flexible, that's a reasonable option, and that's how my couples that were 53 and 56 got pregnant, because they used donor eggs, and they could consider adoption. But for a lot of women, the use of donor oocytes have really changed the whole idea of ovarian aging. But I mentioned the female must be open to the use of another person's gametes, but the real advantages are these successful advantages of using donor eggs, is that IVF is much more successful. There's less loss, there's less emotional disappointment. The woman still has an antenatal bonding experience, and she can experience the delivery of her child. 50% of the genetic material comes from the partner, so the child looks like the two of them. We match the donor to the characteristics of the patient, and it also eliminates the potential loss of an infant as that could occur with an adoption.